Hi, I'm Alexis Schmidt from the Power of the Patient Project, and joining me today is Renuka Sundaresen, who is Director of Patient Access at Einstein Physicians. So welcome, Renuka.
Thank you. Thank you for having me.
So my first question is to please explain your role as Director of Patient Access at Einstein.
Sure. My role as a Director of Patient Access for Einstein Physicians is to ensure that our patients are able to see their providers at a time and place that is convenient for them. This entails the whole spectrum of when the patients call to make an appointment with their provider to the point where they check out of their appointment. So we make sure that our provider schedules are optimized. They have minimal restrictions. They have nothing going on in the schedules that impede patient access. So as a patient access director, I work with a team that helps me achieve these goals.
Great. So how do the initiatives of your team at Einstein directly affect the patients?
Sure. Again, like I said, my team works to ensure that the key to making sure that our patients are able to see their providers at a time and place that's convenient to them is ensuring that their schedules and templates are optimized. By that, what I mean is, given a provider's day and time, we want to make sure there's no restrictions that impede patient access. So we work with the individual departments, we partner with them to make sure that we're leveraging the most out of a given specialty and a given location, and that their schedules are organized in a manner that is allowing us to accommodate whether it's a new patient or established patient in the most timely and effective and efficient manner. So that experience that the patient has scheduling their appointment, we help manage that. My team helps manage that. Making sure that they get the good quality service at the scheduling center, at the central scheduling center. And my team also makes sure that in terms of data, we trend data and make sure that we have the right capacity for the demand that we're experiencing so we can optimize our physician schedules to allow for maximum access.
Okay. So as an advocate of patient-centered care, what do you feel are some of the most important things that patients should know to protect their rights when they're in the hospital or when visiting their doctor's office?
I think it's critical that every patient knows that they have such a thing as patient rights. I don't know how many patients can actually say that they know what their rights are. So I think it starts with patients knowing that they have certain patient rights and then knowing what those rights are. It starts with, there's so many different patient rights that I don't know that there's enough resources that inform and educate patients, such as privacy is something that's very well known. Everyone knows about patient privacy rights, but their right to access to care, regardless of color, culture, religion, ethnicity, gender identity, on and on the list goes on. The patients need to know that they have that right to the access to care with no discrimination. They have the right to receive care with dignity and respect. They have the right to receive the highest quality of care. They have the right to informed consent, which also means that they're being an equal participant in their care delivery. It's important for patients to know that they're equal partners in their care delivery. That means they should know what their options are. What other options do I have? What are the risks and benefits? And do I need to go with the treatment at all? Just knowing these things is going to not only help the patients receive good care, but overall outcome of care is dependent on the partnership with that patient. So I think knowing and educating the patients about their rights is a critical step that we all could do a better job of.
Yeah. Definitely with the power of the patient, we want to really empower patients to
Absolutely.
choose and be informed.
Yes.
So you have obviously dedicated your career to improving the quality of healthcare delivery and also safety for patients and staff. So why is this so important to patients?
Patients, when they walk in the door, whether it's a doctor's office or a hospital, they are trusting the single most important thing to them or their family, which is their health. They want to make sure they are in a safe environment. They also want to make sure that they can trust their providers and the staff to give them the highest quality of care in the safest environment. And that trust is one thing that we as healthcare providers strive to gain and retain every single day. And this trust, when it's broken, it doesn't take much to break that trust. And this trust, when it's broken, it can cause so much damage. So it's important for patients to know that they're in a safe environment where they know that there's true and tried practices that are going to help them achieve the healthcare goal that they're in there for.
Yes, exactly. And my last question
Sure.
is, in your opinion, what are some of the standard policies and procedures that all hospitals should have in place to guarantee that the rights of the patients are protected at all times?
Absolutely. As I mentioned about patient rights, every hospital and physician office must ensure that they have policies that protect these, whether it's the privacy law or their right to receive access to care. But we also have to make sure that we have a mechanism or a policy in place that allows for patients to provide us the feedback, because it is the patient's feedback that's going to allow us to identify if there was a breach of patient right here. And giving that advocacy forum to the patient is a critical piece that should exist in every healthcare setting, which will allow us to further protect the patient's rights.
It's very good. Well, thank you so much for joining us today, Renuka. We really appreciate your time.
No problem. Thank you so much.
All right. Well, I'm Alexis Schmidt, and this is the Power of the Patient Project.